Hello, thank you for joining us. We'll get started in just a few minutes. Hello, thank you for joining us. We'll get started in just a few minutes. Please use the chat feature to bring your greetings and say hello. Tell us where you're coming from. Hello, thank you for joining us. We'll get started at the top of the hour. Hello, and thank you for joining today's webinar. We are ready to begin. Today's webinar is eligible for 1 contact hour. Sigma Theta Tau International Honor Society of Nursing is accredited as a provider of nursing continuing professional development by the American Nurses Credentialing Center's Commission on Accreditation. The nurse planner, content expert, faculty, and others in control of content today have no relevant financial relationships with ineligible companies. To receive contact hours for this NCPD session, participants are required to attend the webinar and log into our learning management system to complete an evaluation form. Information on how to access this will be emailed to all attendees 1 week after the webinar. This webinar is being recorded and will be available via the Sigma repository within a few business days of recording. Following the presentation, if we have time, we'll have a question and answer session. You'll see on your Zoom webinar control panel that you can send a message through the Q&A feature. This is where you can type in any question you'd like to pose to the presenter. Be sure to hit send so the message makes it to us. Please use the Q&A for questions and the chat feature to interact with other participants. We'd like to thank our speaker for sharing their expertise with us today. Of note, thoughts and views expressed are that of the presenter and do not necessarily reflect those of Sigma. Our speaker today is Megan Simic. Megan is a registered nurse with a range of clinical nursing experience in areas such as intensive care, emergency, and pediatrics. Meg completed a bachelor's of nursing and is now undertaking a PhD with a research project exploring lived experiences of emergency department nurses during the COVID-19 pandemic. Meg works as a research fellow within the Collaborative Evaluation and Research Group at Federation University, Australia. We're so thankful to have you. Welcome, and we'll turn it over to our speaker.
Thanks so much, Linda and Megan, for facilitating today's session. I just wanted to confirm that you're seeing the screen that I'm seeing and it all is looking okay on your end.
Yes, it looks lovely. We can see your presentation.
Fantastic. Thank you so much, Linda. So hello, everyone, and thank you so much for attending today's webinar. As Linda had mentioned, my name is Meg Simic. So I am a research fellow in the Collaborative Evaluation and Research Group, and I'm also a registered nurse with a history in a number of different areas, such as the emergency department, intensive care, and women's health. So I'm also a PhD candidate. So I'm a PhD candidate at Federation University here in Australia. So I'm keen to present to you today about the lived experiences of emergency department nurses during the COVID-19 pandemic. And so today, what I really want to go through is what we have learned over this time and how we can plan for the future and how we can use these findings to assist us for future pandemic or epidemic events and also supporting the workforce as well. So I just want to acknowledge that my supervisors are Professor Joanne Porter, Dr. Christopher Massagno, and Associate Professor Blake Peck. So I do want to let you know that today we're going to be using Mentimeter. So if you can have a mobile phone access available or an internet browser ready, so just it will be embedded into this PowerPoint. So I'm really keen for you to interact with the content and let me know what your experiences were as well. So I want this to be a really interactive process so I can learn about your experiences as well. So today there are a number of learning outcomes that I wanted to go through with you. So the first learning outcome is to develop an understanding of the feelings, attitudes, and perceptions of emergency department nurses who worked and are still working on the front line of the COVID-19 pandemic. So our second learning outcome is analysing and interpreting your own feelings, attitudes, and perceptions about nursing during the COVID-19 pandemic. And then third, I'm hoping that we can analyse these research recommendations and then have that help you to construct your own initiatives and practices to support wellbeing in the nursing workforce and where you work as well. So what I'm really keen to hear is which countries you are coming in from for this webinar, just to give me an understanding of sort of background and maybe what, as we know, COVID was quite different globally, and different countries experience different levels of concern with COVID. So I'm keen to get your answers here. I did see from our chat box that we had quite a few from the United States, which is great to see, and obviously acknowledging the concern that you guys have had and continue to have with the COVID-19 pandemic and the impact that it's had on you guys. Fantastic. We've got some from Australia and Canada. Okay, brilliant. So the next question I wanted to put to you is, which area of healthcare do you currently work in? So I just wanted to get a gauge of where you're working, which industry in the healthcare industry you're working at the moment, and also if you're not in the healthcare industry, just to give me an idea of that as well. I've got quite a few nurses, which is fantastic to see. I'm in education and training, a couple in research. And it's also great to see that a couple are not currently in the healthcare profession. So obviously we know that COVID-19 affected everybody, and it affected everybody differently. But we all do have that common link with being affected by the COVID-19 pandemic. Okay, thank you for answering these questions for me. Moving into the first bit of content I want to go through with you is just setting the scene and giving a little bit of background and context. So as we all know, the COVID-19 pandemic was first announced as a global pandemic by the World Health Organization on the 11th of March 2020. And it was then identified in around 114 countries, and it was the first coronavirus announced as a global pandemic. So to date, we have now seen over 767 million cases of COVID-19, and we've seen almost 7 million deaths caused by the pandemic. And of course, these are conservative estimates. A lot of cases and deaths weren't or could not be attributed to COVID-19. So these are the figures that we have available to us from the World Health Organization. What I did want to highlight here as well is it has had an extreme impact on our nurses. So we know that nurses have died in the fight against COVID-19. So the World Health Organization had estimated back in 2021 that 180,000 healthcare workers had died in the fight against COVID. But again, this was a conservative estimate, as they didn't have complete reporting documentation from all countries. And also it was hard to attribute all deaths to COVID. So it was that conservative estimate from the World Health Organization. And this was back in 2021. So obviously there has been some time since those findings came out. What I also wanted to really highlight was that nurses are leaving the profession at a much higher rate. So evidence suggests that ED nurses within 1 year of the COVID-19 pandemic had expressed a greater intent to leave the profession within 5 years. And we're also seeing that play out. So this was back in 2021. We're also seeing that play out as we come into 2022 and 2023, as we're seeing a mass exodus of healthcare professionals from the workforce. So I wanted to give you a little bit of background about the study that is part of my PhD. So with my PhD, I began in 2020 and I began in March 2020. And I had a really interesting opportunity that was presented in coming in as a nurse and coming in a time where we were just going into global lockdowns. And so I'd gone to my supervisors and I'd said, I think it would be amiss if we didn't explore the experiences of nurses during the COVID-19 pandemic, and more specifically emergency department nurses, as we understood the impact that the pandemic was having on them, being on the front line of the virus. So the aim of the study is to understand the lived experiences of emergency department nurses that work on the front line during the COVID-19 pandemic. And we've used a hermeneutic phenomenological approach. So from this approach, we're using a Gadamerian approach. And so this is looking at the phenomena and the essence of the lived experience of a person. So as Gadamer highlights, we are all part of history and we can't therefore look at the past entirely objectively. So we come together with a fusion of horizons of individuals and with texts that we engage with. And so through this fusion of horizons is where we develop new understandings in our life world around us and how we interact with our world. So it seemed quite fitting, especially of what we were exposed to with the COVID-19 pandemic and how it was evolving as well. So the study used a qualitative design. So we used the qualitative design to gain a much deeper insight into the experiences of these ED nurses. There was 3 stages of data collection. So the data collection occurred in 2020, 2021, and 2022. So this was all 6 to 12 months apart, and it was all captured at really important points of the pandemic within Australia. So towards the end of the first year, the end of the second year, and then just after we had the Code Brown in Australia, so mid-year 2022, as we were seeing, 2022 was a time where Australia had an increase in cases, and it had a significant impact on our healthcare services. So there's 4 stages of data analysis as part of this project. So 3 stages of each year of data collection was analysed using a thematic analysis approach. So where we would look at our transcripts as a research team, we'd be exploring potential codes and themes that would come out of the data, and then we'd be collating them to best represent the participants' experiences. We then had another stage of data analysis, which is a case analysis. So we've looked at certain nurses from our sample over the 3 time periods to gauge how their experience evolved over the pandemic. We used a lot of reflexivity in our design. So as COVID was new, it was emerging, and it was something that hadn't been seen within our generation of the workforce. We needed to engage a lot of reflexivity in responding to what was happening at the time. So in my first year of my PhD, we had to jump straight into data collection as it was a very poignant time. It was the end of the first year of the pandemic. We were still in lockdown here in Melbourne, Australia. And so we needed to adapt and change. So initially, we only had the idea to potentially interview these nurses at one stage in 2020, as we didn't know that the pandemic was going to continue on until today. So we use that reflexivity to explore further data collection opportunities with the sample. And that's what it has resulted in today. So for our recruitment and our setting, so we used a snowballing recruitment of these emergency department nurses via social media. So we used Facebook, LinkedIn, Instagram, anything that had a great reach, and that obviously during lockdown, there was a lot of people that were accessing internet, looking at media, being engaged online. So we did a virtual interview session. As we couldn't have face-to-face interviews, we did individual virtual interviews, and that really gave us that depth in our conversation with these nurses as well. It was one-on-one, it was personal, and they were around an hour in length, so we could get quite in depth to what we were talking about. Our population was 10 Victorian ED nurses, and these ED nurses came from both metropolitan and regional areas in Victoria. So they came from city centres, but they also came from regional centres where the pandemic was quite different in both of these areas. So even though we were both in lockdown, there was significant differences in the number of patients that were presenting to hospital and the impact it was having on healthcare workers. So our sample had both men and women, and the sample had between 1 and 38 years of clinical experience. So it was a really broad range from graduate nurses in their first year out of university, just entering the workforce, to some nurses that had been there for 38 years and that were senior management or nurse unit managers within the emergency department. So now I'm going to talk about the findings that we had from 2020, so the first year of the COVID-19 pandemic. So to take you back there and just to bring up a little bit of context, so what was happening and what did we know? So at the time, it's where we went into global lockdown. So from March 2020, a lot of us all over the world, we went into lockdowns, and the world sort of stopped in movement and in what we were doing. However, healthcare never stopped. That continued, and there was a very much increased burden on the impact for healthcare workers at that time. So we were seeing that really high morbidity and mortality with COVID-19, as we didn't have the vaccine and we didn't have available treatments at that time. So there was a lot of concern, there was a lot of fear at that time. It was new and it was emerging. So, and I'm sure a lot of you remember there was a lot of food and critical supply hoarding that was happening in supermarkets and industry, particularly here in Australia. We had hoarding and lack of supply of toilet paper and of certain foods. So there was that additional impact on top of what was happening with the virus. It had that flow-on effect in 2020. So now I want to go through with you the themes that came out of the data that we collected in 2020. So there was 4 major themes that came out of the data. That was mixed messages, changes to practice, living through a pandemic, and 2021, here we come. So within mixed messages, the nurses talked about how the Department of Health in Australia stepped in. So there was a lot of directive that was coming from the Department of Health, and the Department of Health was adapting and changing to the information that was coming through to them globally. This was then being filtered down to our hospital systems, but there was some lag in the time that information was coming from overseas to our Department of Health and then to our healthcare services. So at that time, for many of you, and for this sample of nurses, there was a lot of logistics and planning that took place. Departments changed what they look like. There needed to be an implementation of different clinical environments, stepping up the disease management in respiratory viruses and the spread of the pandemic in that way. So there was a lot of change that happened, tents being put outside, just to separate COVID and non-COVID patients. Here, the nurses also talked about the impact of the media, and this was a really big one. So the nurses in Australia were seeing the images that were coming from overseas, so images that were coming from Italy and from America. And they started to, that caused a lot of concern and a lot of fear for the nurses, as they weren't sure whether we were going to go into something similar, what was sort of coming, and sort of that tidal wave of what to expect. We didn't really know what to expect from a public perspective. And so these nurses were just waiting and becoming adaptable to the changes that were coming, that they were seeing in the media. The nurses also spoke about the public reaction. So from one hand, they had people clapping in the street, people holding up banners, people thanking them for the service that they had so far given to their industry and to their communities that they lived in. But then on the other hand, patients that were presenting to the emergency department were at times violent, they were aggressive, and the nurses in this sample were subject to a lot of negative experiences with the patients that were presenting. And there was that juxtaposition of what was happening out in the media and what was happening within the hospital. So changes to practice, the second theme outlined sort of those acute care changes that took place. So the changes in the respiratory practices that were taking place, and the aerosol generating procedures, how those needed to change in response to the pandemic. The nurses talked about the impacts of wearing PPE and the impacts on patients and families. So at the time, family wasn't allowed into hospital. And so patients were quite unwell, and at times they were dying with no one there available to support them. The nurses also talked about preparedness. So how to prepare themselves within a department setting and how to prepare themselves on an individual level as well. The third major theme, living through a pandemic, was sort of the psychological impacts and how the nurses felt internally about the changes that were taking place in that first year. So they talked about the fear of exposure and that at the time they weren't vaccinated and there was no treatment. So what that may mean for them. The fear of exposure, then also the impact on their families. So what they would take home to their families and how they set up their home life to prevent any cross-infection of the high-risk work that they were doing with their families. The nurses talked about caring for themselves, knowing when to take a break and identifying that they needed to take a break, and the other psychological impacts that were happening at the time, including the stress and the fear of the unknown and what was to come. So then our fourth major theme, 2021, here we come. We had a lot of conversations around that this, the nurses talked about the pandemic as if it was the first and only year of the pandemic and what COVID normal may look like in 2022. They talked about what they'd learnt during this time and that there was positives that came out of the pandemic during that first year in regards to education, training, and being more resilient when it came to disaster preparedness. So I just wanted to give you some of the quotes from our nurses from this sample. So when New York was being hit, they had all of the refrigerated morgues outside of the hospital. Those were some of the discussions that we had. God forbid if we go into a similar state, do we have the resources and do we have the capacity? Another nurse said, in the beginning, it was scary, having to look after junior staff. I remember one girl coming onto shift and she was shaking, putting on her PPE and just being out there. We didn't know which patients had corona and which ones didn't. And another nurse said, we were being physically abused and verbally abused out there. And I guess it makes you really tired and really jaded about the public. They're really ungrateful. Now, what I'm interested to know is what is one word that you would use to describe your 2020 COVID-19 experience? So the first year of the pandemic, what is one word that you would use that takes you back to that time and what you were feeling, seeing, thinking? Incredible experiences here. So traumatic, frustrating, confusing, unpredictable, exhausted, lonely, robbed, petrified. These are really strong and really important feelings that you're sharing, and thank you for sharing them. Challenging, afraid, dystopian. Thank you very much for sharing your feelings there. So now I'm going to discuss with you the second year of the COVID-19 pandemic, so 2021 here in Australia and globally. So what was happening and what did we know? So 2021 was the year that we had the vaccine development and also the rollout. So it sort of came in those two stages, that the vaccine race and also what it looked like when we had the rollout of the vaccine. We had the conspiracy theories and the social unrest that was happening both within our communities and politically at the time as well. Here in Melbourne, we had 262 days in lockdown. So the nurses in our Victorian sample were exposed to almost an entire year of being locked down, where they were either in their homes or they were in their workplace on the front line. So then we also had the economic impacts as well that we were starting to see sort of that 18 months into the pandemic. So we were seeing businesses close, we were seeing still supply being impacted, and we could see that globally, if this was going to continue long term, there was going to be some community, social and economic impacts that we were going to have to deal with. So I want to take you through now the themes that came out of our second data analysis in 2021. So there was three major themes. So the first major theme was on the floor each day. So here the ED nurses talked about that COVID is real. They had many patients coming in that were swabbed and were found to be COVID positive, and they would refuse that diagnosis and say, no, I do not have COVID, I refuse, it doesn't exist. And so the nurses were battling with caring for their patients appropriately, whilst also trying to be mindful of what their patients believed and how to ensure that they were giving their best care that they could to these patients. At the time, there was standing room only. So some of the ED nurses explained that they had 80 people standing in their triage at the one time. The patients were sitting next to each other and informing nurses of if someone was deteriorating, because the ED nurses in triage could physically not keep an eye on all of these patients at the one time and see who was deteriorating. So the nurses were caring at arm's length as well. So the nurses here, they discussed that they had been in PPE for 18 months at this stage, and their patients hadn't seen what their face would look like. Some of their colleagues hadn't seen their faces in a really long time. And so they felt like they were caring at arm's length. They couldn't get those personal touches that you usually would with nursing. Here, they also spoke about that change was constant. So at this point, 18 months in, there were still changes to logistics, there were still changes to legislation and things that were happening in regards to the vaccine rollout and the demand that was put on emergency departments here in Australia. The second major theme was, can I keep going? The ED nurses here talked about never switching off. So they had COVID at home and they had COVID at work. They had COVID in the media as well. So they felt like some of them had implemented within their tea rooms that it was a no COVID zone. So you couldn't discuss the pandemic during those safe spaces. Here they also talked about looking after one another and how important it was to have those collegial bonds, and how a lot of the time the main support that they were receiving was within their relationships with their colleagues and the conversations they were having with their colleagues in regards to debriefing and support. They also talked about old fears resurfacing. So at this stage, 2 years in, there was some feelings that were coming back from the beginning of the pandemic of fear, not sure what to expect. Now this was continuing. They didn't know when it was going to end. And so a lot of them had the first sort of mentioning of perhaps burnout and perhaps PTSD at this time. The ED nurses also talked about that they were not well, but they were coping. So there was a lot of maladaptive coping strategies that were highlighted at this stage. So for some, it meant that they had disconnected from family and friends. For some, it had meant that they had started consuming more alcohol just to help them manage their fatigue and their emotions during this time. The third major theme was what's around the corner. So again, the nurses didn't know whether the pandemic was going to continue affecting them into 2022 and into the long term. So they talked about that the vaccine was making a difference and the treatments that they had were making a difference to the outcome of their patients. And this had given them some comfort both for the care of their patients and also the protection of themselves within a high-risk workplace. The ED nurses here talked about quietly quitting. So what it was like to being required to come into work day in, day out, have to do doubles and triple shifts, and not being able to have leave. So a lot of leave at this point was being removed within Australia, as this was the time that we were heading into the Code Brown. So it was announced that the cases and the load on the healthcare department had become extreme. Similarly, it had become extreme in the ambulance service as well. So a lot of nurses were being told that they weren't allowed to go, that they had to not go on their annual leave, and that they had to be available to the hospital at all times. So some of the experiences here I wanted to share with you from 2021 was, we felt very unsafe working out in triage. Quite often it was a ratio of 1 to 60 and a line of 10 to 15 people deep. And there was just no way we could oversee everyone in the waiting room, as well as continue to triage. Another ED nurse said, I think the whole healthcare hero thing, everyone is a bit over that now. Being told that you're a hero because you don't feel like a hero. The rest of the country is getting on with Freedom Day, and we're just sort of feeling a little bit left behind. Another one said, I think there is a lot of stress. I think there is a lot of burnout. I think there will be a lot of people changed by this. I don't think anyone will not be changed by this. Whether or not they reconsider their career in nursing or their position or stance of what has happened, I don't know. So I'm really keen to hear what your experiences were like in this second year of the pandemic. So in the year that there was the vaccine rollout and the mandatory vaccination that was brought in for many healthcare workers, both here in Australia and worldwide. So here we can see quite a lot of similarities with the nurses from this Australian sample. So it was stressful, nurses were angry, it was horrifying, overwhelming, miserable, resentful. So this was a really interesting finding that we had recognised from the first year to the second year. So in that first year, there was a lot of that fear of the unknown and not knowing what to expect. Whereas in that second year, 18 months in, people were starting to become resentful. The nurses were getting angry. They felt abused. They weren't sure what was going to happen next for them. So I can see that with many of your experiences, this reflects what the ED nurses were feeling at that time. So public anger, morally injured, just coping. And thank you again so much for your answers there. So now I'm going to discuss the third year, so 2022. So last year, what the ED nurses experienced in the third year of the pandemic. So what was happening and what did we know? So at this point that we knew that healthcare professionals were leaving the profession in much higher rates. So we were beginning to see the mental health impacts of extended lockdowns and of social isolation. We were then seeing, though, that the vaccine was having a positive impact on the COVID-19 morbidity and mortality. But then, so there was a lot of added pressure of the return of historical ED presentations. So on top of COVID-19 still being prevalent within the emergency department, the nurses were also seeing the higher acuity and the mental health patients that were returning to ED seeking support. So in our data analysis 3, there were two major themes that were extracted from this data. So the first one was exposed wounds, and the second was Band-Aid solutions. So within exposed wounds, another pound of flesh came out in the data. So the nurses had talked about that it was one thing after another thing after another thing. They were being called into work, there was no reprieve, and it was the conversation of what more can I give? The ED nurses here also talked about the loss of senior staff and that this had a really big impact on the clinical environment and the care they were able to give. So the staff became quite junior and there was a lot of loss of skill within the emergency department. The nurses here also talked about substandard care for the patients that was occurring. So this continued over the 3 years. And it came to a point within the third year that the nurses had said, I am concerned that the care for our patients is remaining substandard and that new nurses coming into the profession, into ED, think that this is the standard of care that needs to be given, and it just wasn't. The ED nurses here also talked about setting protective boundaries. So what it was like to say no to working, that I must go and leave and I cannot do any more shifts and I have to take a break for my health, for my family's health, and for the future of my career. So within the second theme, Band-Aid solutions, the ED nurses talked about the ongoing impact of COVID, so that it was still continuing and that there was no end in sight that they could see. A lot of them still had the spark. So the spark for their profession, they still loved working in ED, they still loved nursing, but they didn't know how much longer they could remain in the profession with the way that it currently was. The ED nurses talked about being scared for the future of the nursing profession, what it might look like in the future with the loss of senior staff and with the standard of care that was being delivered, and the new nurses that were coming into the profession. And here they also spoke about their uncertain future. So they were unsure whether they could continue in the profession. Many of the ED nurses had mentioned that their career was limited. They had intentions to leave, and that based on the last 3 years, there was just no more that they could do and that they had to step out. So some of the experiences in the third year of the pandemic in Australia. So I was feeling like I'm past being burnt out. I don't know what is beyond being burnt out. I'm past it. I'm into another realm. There's like a numbness now. I don't know anymore what I feel. I know I want to stay working in ED and supporting it. Beyond that, I don't know. Another nurse said, the loss of leadership is probably a big one because some of these nurses had multiple years of experience who a lot of people looked up to. So a lot of it was reassurance. And I think a lot of the time, it was a lot of the reassurance that people need. Another one of the nurses said, I'm scared for the nursing profession future. The way it is, I've got big concerns. I'm very concerned about junior and future nurses coming into this. I'm really concerned for these guys that have hit the road in these circumstances, whether they think this is normal, the standard of normal care. I'm worried that it will never go back to the way it should be. And again, I would love to hear your experiences from the third year of the pandemic. So last year, what were you feeling in that third year of clinical practice and within your personal and professional lives? So you can see that some of the hope is coming back, but then at the same time, there are people that have left. So I can see you've left the ED, you're at breaking point, ready to leave, burnout, working through, but then some hopeful, still uncertain, fatigued, more prepared. No respect for medicine, retired early, resolutions. So there are still some positives in there, new life. Concern for quality of care. And the new normal. Thank you for those responses. So now I'd like to take you through just the case analysis. So we had 3 nurses that we wanted to talk about here from the sample. So there was a newly graduated nurse, a nurse educator, and a nurse unit manager. So some of the experiences from the newly graduated nurse. So in 2020, they highlighted we weren't supported as a graduate nurse in the way we probably should have been. It wasn't a priority, sort of left a little bit fending for yourself. Then in the second year in 2021, they mentioned it was a different anxious to say at the start of the year when I was a new nurse and I didn't know anything. I know things now. It's just the anxiety of COVID in general. Will I have a PPE breach? Will I get it and have to be quarantined for 2 weeks again? And then in the third year in 2022, I'm definitely taking that break from clinical nursing for a little bit. I really want to go back because I love it and I love patient interaction and care and patient-centered care. But I just know that to be a good nurse, I have the passion and fire again. you need to have a break now and listen to how you feel and how you're responding to work. So this graduate nurse has actually left the profession within the 3 years. So by 2022, they had left the profession entirely. So the ED nurse educator in 2020 talked about, so the other thing that got me whipped up and anxious was when our hospital started talking about how would we make an intensive care here at the hospital. So all of a sudden, I became part of discussions that I had never been part of previously. So in 2021, the ED nurse educators discussed that my concern was that we were starting to miss things or not provide the education that we should have around other things that would create big safety concerns later. And then most recently in 2022, the nurse educator had discussed, I had actually said to my manager, I think I was burnt out last year. I will burn out again if you keep contacting me. I'm really sorry. I understand the short staffing, but I can't be your first go-to. I'll do my 3 days. I will come into work. I'll do it as well as I can on my days. And then I need to just not be at work. So then we also had an ED nurse unit manager. So in 2020, they discussed trying to convince yourself that this is the right thing. There's so much that we didn't know, and trying to convince 30 other nurses, let alone the medical staff, that this is okay as well. So in 2021, they talked about that people are tired. I'm not surprised. I'm really happy and sort of invigorated by how much my team has stuck together and got on with the job over the last 18 months. But they're certainly tired, and that's noticeable. And then most recently in 2022, I'm not sure that I'll stay in the nurse unit manager role for a long time still. It's a draining role, and it's been extra draining through COVID. So I wanted to go through with you the outcomes and recommendations of this study and where the nurses are now. So 5 nurses stayed in their role and 5 left their role in the emergency department. So it was a 50-50 as to whether they stayed within the ED, and so 7 stayed within the same healthcare service, and 3 left their original healthcare service. So this was from the first time we interviewed them in 2020, and then in 2022 at the end. So I wanted to outline here to you as well where they started and where they've gone. So for the graduate nurses, both of these graduates have left the emergency department. So some working in surgical or cosmetic nursing, and then one has left the profession entirely and is now working in the pharmacy environment. So some have left and gone to research roles, and others have gone to, say, an education role rather than working clinically in the emergency department. The ED nurse educator had left ED and has now gone to become an ICU nurse educator. So some of the outcomes and recommendations that came from this study that I wanted to go through with you. So our first recommendation and outcome was, so the mixed messages from the government bodies, the organisations and the media. So our recommendations from this were around implementing clear lines of communication, both upstream and downstream. So this was around making sure that the ED nurses on the floor had the same information as ED nurses that were within leadership roles and also within the executive department of hospitals. It's really important that we recognise the role that media plays in the pandemic and therefore the impact on clinical practice. So there was a significant impact of the media on clinical practice that may not have been anticipated prior. So this is a really important consideration for future pandemic and epidemic events. We also want to discuss the support of best practice guidelines from a single overarching body. So as we understand, this was a new emerging pandemic. A lot of this information hadn't been put into place. However, we have experienced epidemics before, and we have had learnings from past epidemics. So there is information that we need to be implementing best practice guidelines, and that needs to be from a single overarching body. So the second outcome of ED nurses leaving the profession, some of the recommendations that came out of this was supporting a reduction of fraction in nurse employment to retain the staff. So allowing them to reduce their hours to maintain their well-being. We then also want to talk about considering supporting ED staff transfer to other clinical areas for periods of time. So within this sample of ED nurses from this study, a lot of the nurses discussed wanting to be able to go and try other roles, but still wanting the option to come back to ED. And some of them didn't have the option. They were told that no, they needed to put in their formal resignation and that they couldn't reduce their fraction, say, to 0.8 and then go and do 0.2 somewhere else to give them that flexibility. That wasn't an option for a lot of them. And perhaps it should be something that should be explored to maintain that resiliency. So supporting leave entitlements, we understand that at the time, through the ups and downs of the pandemic, that nurses needed to be brought back from their leave entitlements. But now is a really important time to support those leave entitlements to ensure that the nurses that were on the front line and continue to work on the front line have the opportunity to take leave and to decompress from the experiences that they've had. So another recommendation around fostering newly graduate nurse development of resilience. So putting that support and guidance into newly graduated nurses to help that transition to practice and to have clear expectations of what their roles are and what COVID normal looks like in clinical care and the clinical environment. Something that was really important that we had found from this was reimagining and reinvigorating ED nurse culture. So a lot of the ED nurses had discussed that it was their colleagues and their friends within the working environment was why they came to work. So it wasn't for their role, it wasn't for their management or their organisation, it was for their colleagues. So within departments, having a look at reinvigorating the ED nurse culture, that it is a fast-paced and often exciting, adrenaline-inducing environment. For some people, that is really enticing, and that it is a really tight-knit group. So to come into the fold of ED nursing to make it achievable and to make it enticing again for the next generation and for the current generation of nurses. So another outcome, a loss of senior staff and highly skilled staff. So the recommendations that came out of this were around reviewing the support that was provided to senior ED staff. So not assuming that they have the skills and the leadership capacity to deal with the emotions that were coming both from the staff they were needing to manage, but also their own emotions and the things they were having to deal with at home. So here, capacity and resilience building opportunities would be really important to be implemented within the leadership staff to ensure that they had those skills for future pandemic and epidemic events that we know may be a reality for the healthcare profession. Another recommendation was around upskilling the ED senior management in culture. So making it clear to them that it is the staff were wanting to stay because of their colleagues and fostering that, that group environment again and being the leaders and the champions of that culture within their department. Another outcome, so the lack of professional boundaries within organisations. This was a really big one that the ED nurses had discussed, that being contacted outside of work and asked to do doubles and triples and asked to come in early or late for their shift really took a toll on their well-being. So looking at implementing formal policy to protect the work-life balance of ED nurses, implementing things around maximum number of working hours, and also really importantly, limiting the contact and disruption to staff outside of working hours. So not contacting staff beyond their working hours to maintain their own personal lives and to keep their personal and professional lives separate. So now I'd really, really like to hear what some of your recommendations would be for the future of the nursing profession. So this can be comments, feedbacks, or suggestions based off your experiences and understandings that you would like to see going forward. Sorry. Here we go. So some of your recommendations: seeing nurses as human, mental health days, a fixed nurse-patient ratio, residency programs, a willingness to look at what is under the surface, prioritization of nurse physical and mental safety, mentorship, preparedness, awareness of how nursing was before COVID, stress management, so meditation, yoga, and wellbeing strategies, to find a place you are supported. So a comment: quietly eating the young. So fixing the cracks in the system that were amplified during the pandemic. A menu of relief options, so providing relief to nurses that is meaningful to them. This was something that was really important that came out of these findings, was allowing nurses to be the champions of what the change should be, asking them first, asking them what they need, and then making the changes from that, rather than assuming that the senior, the executive or organizations or industries know what to expect. Courage to make the visible the issues. Pay, professional growth. We've had a couple of mentorships for the ongoing support of nurses, nurses speaking for themselves. Offering education to nurses who started during the pandemic to ensure they know what the standard of care of nursing looks like. Absolutely. Actively listening to those on the front line. Remembering that there is power in the collective. Thank you so much for these responses. They are incredibly powerful. So thank you all for being a part of this webinar today. I just wanted to highlight here some of the works that have come out of this PhD so far. So there are a number of publications and also a number of external media that has occurred as a result of this work. As you can see, the name is a little bit different. I have recently been married and had a name change. So a lot of the PhD work is under Jackson. So you can see my details there, and please, if you have any questions or anything further that you would like to discuss with me, I'd be more than happy to answer those questions.
Wonderful. Thank you so much for sharing all of this great information, Megan. We're thankful that you took the time to share, and we're going to open it up to questions. So if you do have any questions, please use the Q&A feature, and we will get those to Megan for her response. We do have a question in regards to what it looked like in Australia. Did you experience the quote unquote travel nurse phenomenon? In the United States, hospitals suddenly found financial resources to hire temporary nursing staff by doubling or tripling pay for these travelers. And as a result, many staff nurses left to travel. So what did that look like in Australia compared to the United States?
Yeah, so that did look a little bit different in Australia. We didn't quite have that sort of the movement of nurses within hospitals and within those environments. So I know that that also came out in China as well, that there was a lot of travel between hospitals, that opportunity to go and work in different departments and then also come back to your home hospital for pay, for different environments, to be able to support other healthcare services that were struggling. So within Australia, not so much. Due to the lockdowns, we had very, very limited travel. So the limited travel was both personally and professionally. So staff were retained within their departments, and there was a lot of work to maintain all of the staff that were had. There was, so leave wasn't entitled. The staff weren't able to go. It was, everyone was needed in their home base, and then beyond their work environment, they weren't allowed to go anywhere. It was, you were allowed to go 5 kilometers from your home. For a lot of the time, that was the radius. So you were able to travel from home to work and then from work to home.
Thank you for sharing that and putting perspective on what it looks like in different parts of the world. When we were in the pandemic in parts 1, 2, and 3, were there daily rounds there in your hospital on the units where nurses were asked for feedback and input on a daily basis?
So I wasn't working clinically at the time. So from my perspective, I took a step back from clinical nursing just so I could make sure that my experiences weren't impacting the research outcomes and sort of my biases weren't put on to these findings. But what we did find from the sample of nurses that gave our responses was that a lot of the time decisions were made without their input. So whether that be from a leadership perspective, whether it was from a clinical perspective, whether it was from implementing best practice guidelines, a lot of the senior nurses and nurses with that clinical experience weren't actually consulted about what they need to see, what resources they needed, and sort of that consultation about, okay, we can see that there is a gap here. What do you need to see? A lot of these nurses discussed that as the pandemic rolled on, there was things like free pizzas, there was wellbeing chairs, there was massage appointments, there was little bits and pieces that were offered by the organisations. However, the nurses have said, I do not have time to leave my clinical environment. I don't have time to go and sit in a massage chair. I don't even have time to eat lunch or go to the toilet. So I can't get this free coffee that I'm being offered. I can't go and get this free pizza that's in the tea room. So it sort of seemed that there was a disconnect in that communication around what the ED nurses needed and what was offered. So I can't speak to what each different organisation had, but from this sample of nurses, a lot of the time they weren't consulted.
Thank you for answering that and for your honesty. And when it comes to the sample for your study, can you describe the number of nurses interviewed for the research? Was your N number 10?
Yes, it was 10 nurses. So these 10 nurses were interviewed each time. So the participant one, so one of the participants didn't continue to the second and third year of our data collection, but overall there was 28 interviews with this sample of 10 nurses.
Wonderful. And do you have any insight on why the effect of COVID in Europe and other countries look differently than most African countries? Do you have any insight to that?
Unfortunately, I don't have any insight into those changes, no, but I'd be more than happy to find those answers and to provide any guidance on that as well.
And with that being said, we're coming to the end of our time. So I see you have your email address on the screen. Are you comfortable with participants reaching out to you via email if they do have further questions?
Yeah, absolutely. I'd really welcome you to reach out and ask questions and also seek any advice. I'm more than happy to help.
Wonderful. And before I close us out today, Megan, do you have any parting words to share?
I actually do. I'd really like to acknowledge the time and effort that the ED nurses within this sample had given their time during a really critical stage in their lives. And again, I want to extend that to all of the nurses that continue to work on the front lines of COVID. I acknowledge that the pandemic isn't over. For a lot of communities have moved on, but the healthcare environment often hasn't. So I acknowledge your pain and I acknowledge your trauma. And I want you to know that you are heard and that there is a space for you to share your experiences.
Wonderful. Thank you so much for those words and for the acknowledgement of the experiences that everyone is going through. So we want to thank you so much for presenting today and for sharing all of this great information. Sigma is grateful that you took the time to share with our audience. We definitely look forward to hearing more from you in the future. We hope that you enjoyed this webinar. As a reminder, 1 week from today, you will receive an email with the email that you registered with the link with instructions on how to obtain your nursing continuing professional development certificate. Be sure to check out Sigma's upcoming webinars and resources to support you and your colleagues at sigmanursing.org. Also, previously recorded webinars are freely available on the Sigma repository. Thank you for joining us today and have a wonderful day.